once you've gone through therapy, once you have, we call it a toolbox, once you've kind of developed ways in which, you know, from understanding what your symptoms are, once you've gone through all of that, you get to a point where if it does come along, if it does happen again, you'll notice those things probably a lot sooner than you perhaps did before. You will begin to notice some of those things. You know, this becomes your superpower almost, your bit where you go, okay, if I learn to kind of recognise how I'm feeling, recognise that thought or that feeling, I had that before, I recognise what this is, I see this as anxiety creeping in, then actually we have the ability to stop it before it actually flares to the point where perhaps it had gotten you before. You work on that process, that time in therapy, and then I definitely think it gives you a bit of a toolbox to leave with, in the hope that then you can manage these things better by yourself sometimes, learning as well to what changes have I perhaps made in my life that now means that I'm not struggling as much, or, you know, these types of things are all the stuff that you might talk about in therapy, so that you can again have a better understanding of yourself, your needs, what has been triggering me and affecting me, that's perhaps caused that debilitation in your life, and what changes have we learned and made during this process. That you can then hopefully just take on and on and on through life. And occasionally, you know, it tweaks like life does, but you know, that's kind of the hope, leaving clients feeling much more empowered to understand themselves better and therefore regulate and manage their anxiety, and always know, once they've had therapy, always know that if needed, you can always go back at any time. There's no shame in that whatsoever.